Good afternoon and welcome. My name is John Mazzara, the owner of Financial Planning Associates and affiliated with Cetera Advisors. I'm a financial planner and I'm going to be teaching today about Medicare. Now, with regards to Medicare, this presentation is educational only. I won't be talking about any specific companies, their choices and products. Regarding that, I do not offer every plan available in your area. I represent 6 organizations which offer 34 products in your area. You can always contact Medicare.gov, 1-800-Medicare, or your state and local health program for help with plan choices. With that, I'm going to go ahead and share my screen, and we're going to go ahead and look at the webinar today. Okay, so this is entitled Savvy Medicare Planning, 60 Minutes on Medicare Basis. Okay, what is Medicare? Medicare is a national health insurance program for people that are 65 plus. It's administered by the Centers for Medicare and Medicaid Services, known as CMS, and you begin your enrollment through the Social Security Administration. Now, who is eligible? Anyone that's over age 65. Who is a U.S. citizen or a legal resident who has lived here in the U.S. continuously for the last 5 years. Some people under 65 are also eligible for Social Security if they're successfully receiving disability benefits from the Social Security Administration. Now, Medicare has 4 parts. Originally, it was powered and provided just by Medicare, but it's expanded. So originally Medicare was Part A, hospital coverage, and Part B, doctor or medical coverage. Time evolved, and now there's something called Part C and Part D. Part C is provided by an insurance company. It's also known as an Advantage plan. So when you hear the words Part C and Advantage plan, those two terms are synonymous. And what the insurance company is doing is providing at least as good a coverage as original Medicare would have provided under Parts A and B, and many times a significant amount of additional ancillary benefits. And then there's Part D. Part D is the drug prescription plan. Now, Part D, the drug part, can be incorporated in Part C, and unless you're a veteran, it normally is. Part D also is a standalone. So in the event that you opt to go for Part A and B directly with Medicare, and then get a supplement or Medigap policy, you may decide to add the drug portion a la carte, and that's known as Part D. We're going to see more about that over the next few slides. Okay, here we can see the evolution and where Medicare is, and the way that you can cover some of the gaps or get more things. So on the side where we say Parts A and Part B, we describe Part A being for the hospital insurance, Part B being for the doctor or medical insurance. Now, you will have a deductible associated and a cost that's above and beyond what's provided by Medicare that you may want to cover. And so the way to cover that gap or that cost or that coinsurance and deductible is to add at the bottom, you see the Medigap policy. So if somebody ever says that they want to get a supplement or a Medigap policy, what they're wanting to do is to cover the cost that isn't covered under original Medicare's Part A and B, i.e. the deductible and the coinsurance. Now you can also add drug coverage. So drugs are not included under original Medicare. There are some that are covered under Part B, meaning provided by the doctor, but generally speaking, drugs in and of themselves, prescriptions, need to be covered through a Part D plan if you're going to go the supplement route. They go under something called a formulary. So there are various levels of Part D. If you're taking relatively few drugs and or generics, Part D at a lower cost premium with a smaller formulary might be adequate for you. On the other hand, if you're taking many advanced drugs for, let's say, cancer or other heart issues, you may want to get a bigger, better formulary to draw from, and that would be a little bit more of an expensive Part D premium. On the right-hand side, we have the Medicare Advantage plans. Remember, we talked earlier and we said that Medicare Advantage plans step in on behalf of Medicare itself and they provide the Part A and B coverage. So they provide the doctor and hospital coverage. In addition, they typically have their own formulary and they cover drug coverage. Where they don't is if a veteran signs up under a veteran-specific plan where they continue to receive their drugs directly from the VA. There are some companies that also allow you to opt out of the Part D coverage. So you would not have drug coverage if you selected that type of an Advantage plan. But most Advantage plans that I see in the marketplace are inclusive of Part D, and i.e. then a formulary for drugs. Now, how do you go about enrolling for Medicare? Well, the basic principle is unless you're covered by a large employer group plan that covers 20 or more employees, you must enroll on Medicare when you turn 65. Now, you want to get, if you're going to stay on your group plan, you want to make sure that it is credible coverage, meaning that it suffices in place of having original Medicare Parts A and B. Most large employer plans are credible coverage. And when we talk about the plan and the credible coverage, it could be your spouse's employer plan that's providing that coverage for you. So many times there'll be one spouse that might have a better plan through work, a group plan, and then that's covering both people. Not all the time, but a lot of the time. So you want to make sure that whatever plan that you're under, yours or your spouse's, that it is indeed credible and suffices as a replacement. So we don't want to go beyond age 65 and not have either credible coverage or having signed up. The reason is, well, of course, you would have a gap in coverage, which could be extremely expensive and devastating if you needed medical care. But there's also penalties that are in place for the rest of your life if you don't sign up at the appropriate time. So the longer you wait, the larger the penalties associated with waiting. So what if you don't enroll in Medicare on time? Well, I just mentioned that. You may pay late enrollment penalties. Your healthcare expenses may not be covered because you don't have any insurance. And private insurance options might be available to you, but they might not be because you're, again, supposed to have been signed up for Medicare. So make sure that you understand the deadlines, and we're going to cover that here in just a little bit, but make sure that you understand the deadlines and sign up when appropriate. How do you enroll in Medicare? Well, if you're already receiving a Social Security benefit, when you turn 65, Medicare will automatically be enrolled. So then you'll be in Parts A and B unless you decline Part B. So if you're already receiving a benefit, maybe you sign up at 62 or 63 or 64, you'll get a letter with your card saying you're good to go for Parts A and B, and it'll have an effective date of the month of your 65th birthday. Coverage always starts on the first of the month. It never is prorated. You can sign up within a month, but it's always going to begin on the month following on the first. Part C and D are not automatic. So if you want an Advantage plan, or you want a drug plan, or you want a supplement, all of those you have to seek those out because those are being provided by a private insurer and you have to proactively enroll. So that does not happen automatically. The baseline for signing up for any form of insurance requires that you already have A and B in place. So how do you enroll in Medicare? If you're not receiving Social Security and you're turning 65, well, you have to sign up through the Social Security Administration during one of your enrollment periods. Now you can go to ssa.gov. You can visit your local Social Security office, or you can get on the phone, maybe wait 45 minutes and get through and sign up over the phone. So there's 3 different ways that you can sign up at the Social Security Administration for Medicare. Now, everybody, when they're turning 65, has something called the initial enrollment period because you're only turning 65 once. So you're not covered, if you're not covered by a group plan, that's what you might end up doing. But if you do have a group plan, I would still encourage you to do a comparison because what you might find is that opting out of the group plan, even if you're continuing to work, might be a better option in terms of benefits and cost. Now, we won't know that until we actually do that comparison and do the math. You may need to stay on the plan, though, if your spouse is younger and relying on the group coverage that you're providing for them. So there's different reasons why you might or might not opt out of a group plan, even if you already are covered. Now, let's say you continue to work. So you're working and you're still in the group plan. Now you retire at, let's say, 67. Well, that's after age 65. So what you'll do is utilize what's called a special enrollment period. So when we fill out the application, we check the box that says you had credible coverage because you had your group plan while you were working, and now you're retiring or leaving the group plan and you're using your special enrollment period. And there's another time to be aware of, and that's called the general enrollment period. So let's say that for whatever reason, you were supposed to have enrolled under one of those two above periods, the initial or the special. And for whatever reason you didn't, then every year there's something called the general enrollment period, which is an open time which you can catch up and reintegrate into a plan if that's what you want to do. So there's the general enrollment period if you haven't utilized one of the other two enrollment periods. So here's what we talked a little bit about earlier, is that if you sign up the month before you turn 65, coverage starts the month you turn 65. You're always doing it 1 month in advance. So if you sign up a month you are 65, well, then coverage is effective the first of the following month. If it's 1 month after you turn 65, then it's the next month on the first, and so on and so on. So it's not prorated during the month of, it's the month following. So who signs up for Part A during the initial enrollment period? Well, almost everyone. Now, I'm going to encourage you to call your benefits administrator and HR and ask them, should I sign up for Part A? Part A, for the most part, is free. If you've worked over 40 quarters, so basically 10 years, you're going to be covered and it's going to be free. So there's no cost to sign up with A. And what it might do for you is give you more hospitalization options through your employer plan and through Medicare directly. So many people will sign up for Part A only if they remain on their group plan post 65. However, do not sign up for Part A if you are going to continue to participate in your HSA. You cannot do both. That's just a Medicare rule. So if you want to participate in your employer HSA and your employer is over 20 employees, then you don't sign up for Part A. So again, always discuss this with your HR representative so that you make the right choice. Now, who signs up for Part B during the initial enrollment period? Well, these are people that are turning 65 that are not covered under a group plan. And here are some examples. So maybe you're not working. Maybe you're self-employed, you have a small individual plan. Maybe you're covered by a company with less than 20 employees, or you're possibly on COBRA, receiving retiree health benefits, or employed by a company whose health plan is less comprehensive than Medicare. And that would mean that it's not a credible plan. That's what it's called, credible. So if you work for a company that's less comprehensive than Medicare, or the health plan is, then it's not credible. So those are the times that you sign up for Part B, because you're required to. Well, you're encouraged to. There's penalties if you don't. So who signs up for Part D during the initial enrollment period? Well, that's for people who've signed up for Parts A and B already and want prescription drug coverage. Now, if you sign up when you're first eligible, there is not a late enrollment penalty. However, if you sign up after that period of time, there is a penalty, and it's 1% after 63 days of when you were supposed to have signed up, and that's a permanent penalty, 1% each month based on the average cost of a Part D plan. So these things, if you don't sign up for them when you're supposed to, again, there are permanent financial penalties associated with a later enrollment date. So two options for Part D. It could be a standalone prescription drug plan. We talked a little earlier about how that standalone drug plan can be a basic or an enhanced, meaning the formulary can be limited with a basic plan and it includes more drugs under the enhanced. There's obviously a premium cost differential. The more drugs that the insurance company is covering, the more expensive that Part D plan will be. Now, you could also get Part D incorporated within the Advantage plan. We talked about that, and that's Part C. So remember, Advantage plans and Part C are synonymous. The special enrollment period to review is for people who did not sign up for Parts B and D during your initial enrollment period because they were covered as a worker or a spouse of a current worker of a company that has greater than 20 employees and the group plan is deemed credible. So if you have credible coverage, again, you can continue to work and not switch. It's up to you. And there will not be a penalty when you do sign up, when you leave that group coverage. So can you sign up for Part B? Well, typically what somebody will do is sign up in the same month that they're going to, let's say, retire and leave the group altogether. So they'll notify HR, hey, I'm going to retire on June 1st. And they will have already signed up for Parts A and B. We will have already picked a plan that's appropriate and have that effective date to be June 1st. So you're going to go seamlessly, typically from a group plan to an individual plan, either being the supplement with the drug plan or the Advantage plan with it all inclusive. So typically it's going to be timed at the same time that you end up retiring. However, you do have 8 months from the time that you do drop group coverage. So you might be on COBRA during that period of time. You might be without coverage, which would be a bad thing, but you might be without coverage altogether. So you never want to not have insurance because you don't know when that health event is going to happen. And unfortunately, I could give you many stories of people that thought they could, wait, and then that health event happened, and now it's catastrophic financially. So you don't want to do that. You always want to have some form of coverage so that if you do get sick, that there is something, meaning insurance, between you and that bill. The special enrollment period for Part D is anytime before your coverage ends. So if you know you're going to retire again, let's say June 1st, that you would have your Part D enrollment period to time directly with that loss of the group coverage. Now, if you go beyond 63 days after your group coverage ends, then there'll be that 1% penalty per month for life. So the best time to enroll in Medicare to avoid the penalties is to sign up during your initial or special enrollment periods. We want to avoid gaps in coverage, and we want to sign up before our coverage ends so that we can go from one to the other. If you missed the initial or special enrollment period, there is the general enrollment period. Now, this time is January 1st to March 31st. This time period is also when there's something called the open enrollment period. So the open enrollment period is different from the general enrollment period. The general enrollment period is for people to sign up to get Medicare in place, get a policy or insurance policy in place because they didn't sign up when they were supposed to have signed up. Your coverage will always begin the month after you enroll. So if you miss signing up for A and B, you got another shot at the apple between January and March. The open enrollment period during this time allows you to disenroll from a Advantage plan and sign up for a different Advantage plan, or disenroll from a prescription drug plan and go back to original Medicare. So there's something else concurrently going on during January to March. And so just know that there's another election that's occurring during this time period. And we can go more into that at another time, but I want to let you know that the months of January through March are concurrent with the open enrollment period as well. So today we're talking about the initial enrollment period, the special enrollment period, and the general enrollment period. The initial enrollment period for review is for everyone age 65 who is not covered by an employer-sponsored group plan that covers 20 or more employees. The best time to sign up is early. So that would be as early as 3 months before your 65th birthday. and coverage starts the first of the month that you turn 65, if you signed up in advance. The special enrollment period is for everyone over 65 who's covered as a current worker or spouse of a current worker under a large employer plan that's deemed credible. Best time to sign up is before coverage ends, and that would be before you retire. So get everything in place so you can go from one to the next. Coverage starts the first of the month if you enroll no later than the month after coverage ends, or the first of the month following the enrollment if later. The general enrollment period is for anybody who missed the initial enrollment period. You can sign up at that time between January and March for parts A and B. Coverage starts the month after you enroll. How do you do it? You go out to ssa.gov. See that little button, apply for Medicare benefits? That's where you go. You don't go to medicare.gov to sign up. You go to ssa.gov. Or you call them on the phone, or you go down and visit the office. Now, how to sign up? You have to decide if you want just original Medicare and then add Part D or a supplement. Or if you want an Advantage plan, Part C, which would cover everything, Parts A, B, and D. So you'll have two choices, but it all starts with signing up for Parts A and B first. You have to have that in place in order to add the insurance component, either the gap coverage and drug plan or the Advantage plan altogether. So Medicare and private insurance. When you sign up for Medicare, you'll have various costs. Part B will have a premium associated with it. So that's again for the doctors. Part A, remember, for the hospital, does not have a premium under most circumstances, and that would be for people that have worked 40 quarters. Or a spouse of somebody that worked 40 quarters. Private insurance premiums are what you pay for Part D drug plan or a Medigap policy or an Advantage plan. So you buy those products to dovetail directly with original Medicare or to replace original Medicare. There are other out-of-pocket expenses when you go on Medicare. One of them is a deductible. You may pay a portion of the doctor bill that's not covered by Medicare, or there might be other services that you need that aren't covered by Medicare. For example, long-term care, not covered by Medicare. If you have a Medigap/supplement, you will not generally get any ancillary benefits like hearing aids or dental work, that type of thing. You might have access to a network of providers that provide that care at a discounted basis to members, but the plan itself under the supplements typically don't provide anything other than coverage for the deductibles that are associated with original Medicare. Some of them may give you a few extra goodies, but they're pretty skinny. Okay, so with the premiums, Part A we said was 0 if you or your spouse paid in for over 40 quarters, so that's 10 years. If you or your spouse worked less than that amount of time, then there is a cost for Part A. It's $285 a month if you've worked 30 to 39 quarters. It's $518 if you've worked less than 30 quarters. So that doesn't apply really to too many people. It might apply to people that are here from another country that didn't put in enough work time into the system, but have been here over the 5 years and are a resident, for example. Part B, this changes each and every year. Now, this is the premium that it is for 2025, and that amount is $185. You may pay extra on top of that. It's called IRMA, and that's an income-related adjustment, hence the acronym IRMA. And what they do is they look at your tax return 2 years prior, the Social Security Administration does. And then that's how they determine what income that you are reporting on your taxes, what your premiums will be for Medicare. Most people, when they retire, will pay the $185, but some pay more, and some pay more for a year or two because they had very high incomes at the end of their working career, or they sold things like cabins, stock, those things that kicked up their income. We're going to see that grid here in just a moment. Part D premiums, again, that's insurance. So it's paid by a private insurer. Varies with the plan, but you also have an income adjustment associated with Part D. If you have a lot of income 2 years prior, then you will pay more than the baseline premium for Part D. This is what I'm referencing. So for 2025, the monthly premiums for Part B and D, including the income adjusted remotes. So if your modified adjusted gross income, that's what MAGI is less than or equal to 106,000 for a single person, or less than or equal to 212,000 for a married filing jointly, your premium will be 185. If your income exceeds that, you see on that chart that there's a surcharge, and that's the IRMA premium that's due in addition to the base premium. So you can see that in that column, and then all the way over to the right where it says total parts B and D premium, that's the amount that you would pay off of the base plus the income adjusted amount. If you go and you only have original Medicare, so this means you don't have insurance, these are the costs associated. Initially, when you go into the hospital, you pay a deductible to Medicare of $1,676. Part B, you pay a deductible of $257. Now, some things are covered, like flu shots, mammograms, so some screenings are covered. But any other thing that you would see a doctor for, other than the exclusions, you would have a $257 deductible. And for drugs, it could be as much as $590 for a drug plan deductible. So this is the worst case with regarding to the initial deductibles if you only had original Medicare. Going the next step, so if you're in the hospital under just original Medicare, days 61 to 90, you'll pay $419 a day. Days 91 to 150, $838 a day. And after day 150, you're on your own. Skilled nursing is $209.50 for days 21 to 100 is covered before that. And after day 100, you're on your own. Here's where it gets pretty scary as well. So not only do you have the hospital deductibles, but under Part B, it's an 80-20 program, meaning Medicare will pay 80, you'll pay 20. Well, that's 20% up to how much? There is no how much because it's unlimited. So think about that. You have $1 million doctor bill, you're on the hook for $200,000 or more because they can do something called balance billing, and they can charge you more than the 20% of the Medicare approved rate. And again, this only would be if you only signed up for parts A and B and did not augment your choice with some form of insurance. Part D, there's going to be some co-insurance. And this is kind of interesting because under all drug plans going forward, the maximum that you are going to be exposed to will not exceed $2,000. It may or may not have a deductible, again, depending on the plan that you choose. And you'll cost share into the cost of the drugs after the deductible. But once it hits 2,000, it's all on the plan. This again assumes that you have insurance, either Part D standalone or an Advantage plan. If you don't, then you're of course on the hook for all the costs of all the drugs. So what Medicare covers is the hospital, the first 100% of the 60 days, 80-20, they cover 80, you cover 20, and some preventative services. So you can see how wholly inadequate that would be to only have that because of the financial exposure, meaning everything that you worked for your whole life, you get sick and you have an extended illness. It could be extremely costly and could wipe out your assets. What Medicare does not cover is long-term care. Some people mistakenly think that it does, and it does not. So long-term care is a real thing to think about, and we can talk more about that on your specific situation and how we might be able to cover that if that's something that you want to cover, but it's not covered by Medicare. Also, care delivered outside of the US, it's also not covered by Medicare. There might be some reimbursement, but you might be best served to get coverage for your trip if you are taking a trip outside of the US, so that you know that you have that policy to rely on. Medicare in and of itself does not cover dental care, nor vision care, nor hearing aids. Certainly not cosmetic surgery, acupuncture, and alternative care, or amounts over the Medicare approved amount where you could be balance billed. Amounts not covered by deductibles and coinsurance. So Medicare is great, but Medicare doesn't cover everything. So what private insurance does is fill that gap. So private insurance, whether you get a supplement, Medigap policy, i.e. the same thing with a drug plan, or you get an Advantage plan, which is all in one, A, B, and D. The insurance is covering the Part A deductible if there is one, the hospital costs after 60 days, the 20% of the doctor bill that Medicare doesn't pay, i.e. the balance bill, the surcharge. For prescription drugs, it may cover the deductible depending on the plan that you choose, and it covers most of the costs of certain drugs during the initial period and the catastrophic period. Medigap policies are sold by insurance companies to cover the gap, hence the name Medigap, or supplement. It's supplementing the cost that's not covered by Medicare. But you're always buying those directly from an insurance company. They're sold by brokers or directly by the company, and they're meant to supplement, if you get a supplement, the gaps. They're typically standardized, and so in that sense, one company offers the same generally as the other. There's not a large variance amongst the plan types themselves. In Minnesota, we have something called basic and extended basic. In other states, we have letters, meaning plans A, B, C, D, E, F, G, for example. We're more standardized in Minnesota than some of the others that are out there. Medigap. Medigap is, again, the same thing as a supplement. So I just mentioned that they're standardized, so it makes it a little more easy for you to compare because there aren't as many moving parts. There are a lot of moving parts amongst the various Advantage plans, but not so much amongst the Medigap supplement policies. So you pay a monthly premium, and it allows you to go wherever original Medicare is accepted. There are no gatekeepers, there are no preferred provider networks. The Advantage plans can be HMOs or they can be PPOs, preferred provider organizations. What I'm seeing in the marketplace is the predominant type of plans that are being created and sold are PPOs, preferred provider organizations. So when the insurance company creates that, they have a network, and then that network provides care at a lesser cost than if you go outside of network. So Medicare Advantage plans, they have to be approved by Medicare. They file every year with Medicare what they're going to do for the following year, and then Medicare approves it. They're called Part C. So when somebody says, I want Part C, or they say, I want an Advantage plan, they're saying the same thing. These are run by private insurance companies, and they step in on behalf of Medicare. Medicare pays them to provide the same benefits as if Medicare had provided them directly. Medicare pays the amount for each member's care. I've been told it's approximately $900 a month. It could be more, could be less, but that's what Medicare does, is they're offloading that responsibility to the insurance company for the administration of that benefit. You may have to use a network if you do an HMO. You may be encouraged to use a network if you're using a PPO. Plans, most of them include prescription drug coverage. The less expensive the premium, the less robust possibly the plan might be, meaning it might have a deductible, a cost associated with it. They may include extra benefits like vision or dental, or hearing or acupuncture or chiropractic, as well as other goodies like gift cards to be used at various places like CVS, for example, which cover OTC items like shampoo and toothpaste and vitamins. So what I'm seeing is that people, once they understand both, may have a preference, and that might be determined by their budget, by their health, and their future projection of what they think they're going to need health-wise and how they're going to utilize or want to utilize the healthcare system. So there's no right answer. There's a right answer for you, and that's whatever your answer is. So there's advantages and disadvantages, in my opinion, to both. And that's what we want you to do, is to understand them both completely so that you choose what's right for you. So Medigap policies are standardized as far as the benefit, but the cost varies. And that varies oftentimes based on the size of their pool of insured people and their experience, meaning what it's costing them to deliver the healthcare. So the plans, maybe with a higher loss ratio, are going to need to absorb that by maybe raising their premiums because it's costing them more. Depending on where you're in the country, you may choose a letter plan like an A to an N. If you're Minnesota, you probably aren't going to do that. You're going to choose a extended basic or basic plan. You want to choose from a reputable company because what you don't want is for them to go out of business and then you have to re-enroll. You would be allowed to do that under a special election period if the company you had went out of business, but that's not the goal. The goal is to pick a solid carrier with solid benefits right off the bat. Let's see. Make sure your healthcare provider possesses the billing or processes the billing for the company you choose. You may have a conversation with your doctor or provider as you're picking plans to make sure that they cover or want to work with certain plans. One of the things with Advantage plans is, although they have a network and the ability to go out of the network, if your plan has a disagreement with one of the plan providers of healthcare, you may not be allowed to go there. So that's happened recently in our state of Minnesota, where a couple of the plans have had issues with some of the providers of healthcare, and the members that were with that plan had to look at enrolling in a different plan for the following year. You're always going to find out about that with your annual notice of change letter that occurs usually that first week of October, right before the annual enrollment period, which is October 15th through December 7th. And that allows you to change each year. So there's an annual enrollment period, which reflects your ability to do some shopping if your needs have changed and you want to have a different something for the following year. Drug plans, of course, are going to be variable. If you're on lots of meds, make sure you pick the right plan so you're covered. And Advantage plans change. The premiums are as low as a zero premium plan to generally up to a couple $100. So there's a variance in terms of your maximum out-of-pocket exposure and some of the allowances for some of the ancillary benefits like dental, like hearing, like vision, meaning as you pay more in terms of a premium, you typically are getting a more robust Advantage plan in the sense of more dollars to use within the plan and a lower maximum out of pocket. So final word on healthcare costs and retirement. Rising healthcare costs will lead to higher insurance premiums. I hope insurance comes down, but the last time I looked, just like the cost of eggs, they typically have been increasing. So I don't think the trend is for health insurance to decline in cost. So expect that in retirement. Make sure you plan for that as you do your respective planning and budgeting. There are higher out-of-pocket costs for services not covered by Medicare or Medigap policy. So just know that if you opt for a supplement and you don't have coverage for ancillary benefits, you'll either have to get ancillary insurance for that or be prepared to pay for that separately. As your health status changes, you may change your plan once a year during the annual enrollment period. So make sure that you read your letter, your annual notice of change, that you review what's been provided to you under the new plan for the following year is what meets your needs best. And you have that ability to change for the following year on January 1st if you have an Advantage plan or a prescription drug plan. So here we're just saying these are services typically that aren't covered by insurance and you have to get them a la carte. Now, some of these are covered under an Advantage plan, but one that is not is the long-term care. That is absolutely not covered. If that's a concern of yours, we need to address that alternatively. So there were a couple of studies done on what it might cost you during your days in retirement from 65 going forward. Fidelity did a study, and their study shows that for a couple, they will spend $315,000 on healthcare premiums and healthcare costs during retirement. For individuals that are single, you can see it's $142,000 for men, $159,000 for women, and that's done by the Employee Benefits Research Institute. So of course, look at your own self, look at your own genetics, see what you're likely to do based on how you live your lifestyle and what your familial history is, and your number might be bigger or smaller, but make sure that when you're again doing your budgeting, that you're considering the fact that you will have expenses for your healthcare that you'll need to pay in retirement. Long-term care is not covered. Skilled nursing care, no coverage is after 100 days. And help with daily activities, no. So if you need or you can't do 2 out of 6 activities of daily living, you can't look to your Medicare to provide somebody to help you with that because there is no coverage for that. What does it cost to bring people into your house? Well, here's what it is. This is a median that was done, median survey across the United States by Genworth. We see that homemaker services are $189 per day. Home health care aides are $207 a day, adult daycare, $95, assisted living, $176 per day, semi-private room in a nursing home, $285 per day, and a private room in a nursing home, $320 per day. So you can see it's very costly if you need assistance and or more of a longer permanent type of extended stay in a facility. So what is long-term care good for? Well, it gives you choices. So that's what I think one of the most valuable things about having it covered directly or indirectly, meaning having a policy or another financial product with the rider, is that it gives you choices on how care is going to be paid for and who's going to deliver it. And you're not spending down your assets nor burdening other people because you have a policy or a benefit that would take care of it. Now, there's a huge variance amongst the ways to cover long-term care. So we won't go into that here other than to say, if that's of concern, let's have that conversation and let's review what products and what products are out there and how they work and how they could augment what you're doing. So 3 reminders for you today. Enroll in Medicare on time. We want to avoid penalties. We want to go seamlessly from one plan to another. Number 2, shop carefully for private insurance to go with Medicare. So Medicare in and of itself, in my opinion, should include something to cover the extra costs. And that's either going to be the Medigap policy and the drug policy, Part D, or an Advantage plan, Part C, which incorporates both. So the third reminder is to plan for higher healthcare costs in retirement so that you budget appropriately and don't overspend because you're underestimating the cost of what it's going to cost you to get your healthcare in retirement. And with that, I want to say thank you. Thank you for coming today. If you have any questions, please reach out to me. You can reach out to me via email, via this website, or via a phone call at 612-386-7027. Again, my name is John Mazzara, and I thank you for watching.